is to show doctors and nurses how to order, document and mix factor concentrate for patients with hereditary bleeding disorders. There are 4 factor concentrates. Presently in the Cork University Hospital we use Advate for the treatment of factor 8 deficiency, Benefix for the treatment of factor 9 deficiency, Wilate for the treatment of von Willebrand factor deficiency, Nova 7 for the treatment of factor 7 deficiency and the treatment of inhibitors. In the Cork University Hospital, factor concentrate is ordered on form 15. The patient's details are fixed here. The doctor puts in the date, the time, the name of the factor, which is the product, the number of units that are required, the doctor's signature and the bleep number. Once that is completed, it is ordered through the blood bank as like any other blood product. So it is ordered through the blood requisition form. So the patient's details are put in here, the requester's details are put in here, the date and time of request and the date and time required. At the bottom of the page is other products. So you write in the indication for treatment, you tick off the factor concentrate, you write in the type of factor that is required, and you also put in the number of units that is required for the patient. This then is taken out of the book and sent down to the blood bank. The porter then must collect the factor from the blood bank. Before he collects the factor, the yellow slip is ordered on the computer by a nurse or a doctor. This yellow slip is for traceability of the factor concentrate from the laboratory to the ward. So when the porter arrives to the ward, he arrives with the yellow slip, a white slip also for traceability, and the factor concentrate, which is Advate. Once the factor arrives in the ward, whatever nurse receives the factor must sign her name here and the date and the time that she had received the factor. When the patient is to receive the factor, the white sheet, the yellow slip and the factor is brought to the patient's bedside. The factor concentrate is checked, that is the name of the patient, the MRN number, the date of birth. It is the same with the ID of the patient and the patient's chart. This is checked by 2 people, either 2 nurses or a doctor and a nurse. Once the patient has received the factor, there are 2 barcodes on the Advate product. The thin barcode is taken off like this and it is placed on the yellow sheet where it states place small or peel off strip here. So that is placed here and that states the product and the number on the product. It is signed by the person who has administered or transfused the product to the patient and the date and the time. This then is sent back down to the laboratory. The number on the Advate or the product is ticked off here and it must be the same number. Once that has been completed, this then is placed in the back of form 15. So this is stripped and this is placed in here as such, as with any other blood product. The factor concentrate has, which I will show you in a few minutes how to mix it, but it has been mixed and given to patient. The bigger strip then is taken off and is placed here, where it states on page 9, factor concentrate. So it's placed here, not here as you would place for blood products. The date and time is added there. The 2 people involved in checking it, one person sets it up so her signature is there and the person who checked it, the signature is there. The time it was commenced and the time it was completed. Advate is given slowly over a 3 to 4 minute period. So that completes the ordering and the documentation of factor concentrate. I will now proceed with mixing of the factor concentrate. I will now demonstrate how to make factor concentrate starting with Advate. We have a sharp spoon and gloves are needed. This is not a sterile procedure but a clean procedure. Anything that is needed is in these boxes. Solvent to mix with the factor, the powder for the factor concentrate and the wax jet. In the other box we have the butterfly, syringe, the alcohol prep packs and instructions, and a band-aid if needed. I'm discarding this. So I'm now going to wash my hands as this is a clean procedure. I'm going to remove the cap from the solvent and from the factor powder. This is the wax jet. I will peel off the top. And as you note, this is clear and this is white. Clear is for the solvent and white is for the powder. So I'm just going to press this into the solvent. I hold on to the vial and I remove the top of the wax jet. I will lift this now and invert it into the powder. And this will mix automatically. When this is mixed, I will check to see that the powder has dissolved, which it has. I will now open off the paper for the syringe. I will remove the cap. I will attach the syringe. I will turn the vials upside down so that the factor is here, and I will draw it back nice and slowly. I will remove the syringe and expel the air. If the patient doesn't have a lining, I will use a butterfly. Otherwise, if the patient has a line, the factor is given through the line and is given slowly over 2 to 3 minutes. I will discard my sharps. And if I was using the butterfly, discard. And the alcohol prep is used for the skin if you're using a butterfly, and it's used for the hub if you are giving it into the line that the patient has. Also, there are instructions in all the factors, and this is the instruction for the Advate. Thank you.